Stance phase evaluation. So the patient is standing there, so the point of contact that you want to find, first of all, is the PSISs. Okay? Then you're going to check the right side and the left side, or the left side and the right side. You know, which side goes first doesn't really matter. So to be able to accomplish that, what you're going to do is one of your thumbs is going to stay on the PSIS. Your other thumb is going to move over to the second sacral tubercle. It's opposite to PSISs. Is the second sacral tubercle. Now, whether you're really on it or not doesn't necessarily matter. You just want to have your thumbs be symmetrical. And so what's going to happen with this test, and I'll demonstrate it on either Dr. Prashad or Dr. Keith in a second. The patient is going to lift their leg up into flexion, which makes the pelvis rotate posterior, correct? Mm-hmm. So if the pelvis rotates posterior, what happens to the PSIS? It goes inferior.
Inferior goes down. Yeah, because it's up here and then goes
so,
down. Okay.
If there's a fixation in the joint, when the patient does this maneuver, they're still going to be able to go in flexion, but the PSIS is not going to go down. So a normal would look like this, and a fixation would kind of look like that. All right? Now, in order to be able to make contact, what's important... Yep. You want to try to make sure that clothes are kind of out of the way, so there's no artifact. Like if you had a T-shirt on and it was hanging down and I couldn't see my thumbs. Let's move forward. Okay, so I'm going to find the PSISs. Now this is where it's kind of like, oh, I can find them when they were laying down, but now I can't find them when they're standing up. And this is better to do if you're seated, and you can either be seated on a chair like this, or you could just be seated, on the table and have the person, stand in the aisle way. Either way. So I'm going to find the PSISs. So this hand is going to stay on it. This other hand is going to move over, so my thumb, my two thumbs are just opposite each other, right? Now, in order to make good contact, I have to put pressure in, right? So in order to do that, I'm kind of grabbing him with my fingers. So I'm kind of pulling with my fingers towards me and pushing away with my thumbs. So if I didn't push away, if I didn't grab, I just end up doing this, right?
Yeah, that's good.
Yeah. So, as you can see, I'm kind of grabbing and pushing. So now that I've made my contact, what I'm going to ask the patient to do, I can lift your right leg up. So bring it back down. You see how that my thumbs went inferior? Do it again, Keith.
Oh.
So that indicates that there's some mobility at that joint. Now to do the other side, I'm going to move to the left PSIS. My thumb moves over theoretically to the second sacral tubercle, but primarily just moves over so it's symmetrical or horizontally leveled with my other thumb. Now lift your left leg up for me, please. Get back down. Now, did that move as much? No. One more time. Okay. Now, it moved a little bit, but not that much. One of the things you have to become comfortable with is how much it moves, how much it doesn't move. You can't say, oh yeah, it moved an inch, it's okay. It's just, you have to get that sense after a while. If you do it enough times, does this feel like it really, moved or not? Okay, so again, this is called the stork test, because don't storks kind of like do this kind of thing?
Oh, that's a crane.
That's a crane, okay. And then you would do the right side and the left side. So in this test, if you have adequate movement or more movement, it means that the joint is not fixated. If the joint does not move, it means it's fixated. Okay? So it's pretty simple. As I said, you could stand or sit on the table and have the patient, stand there and do that. Because it's easier if you're seated because you want to be at the same level of what you're doing. If I was doing this up here like this, I really couldn't see what's going on. So you want to be, at the same level. Okay. Everybody got that one? So that's the stork test, also known as the swing and stance phase evaluation. Swing and stance phase is because this leg is in stance, this leg is in swing. This leg is in stance, this leg is in swing. So, like that. Okay, so the other one, the seated and standing flexion tests. I'm going to demonstrate the standing flexion test. These are both evaluating motion in the sacroiliac joint. So, in the standing flexion test, I'm going to do much the same thing. I'm going to find the PSISs. I'm going to put my thumbs so they're on contacted. And again, I like to use that inferior hook because that's symmetrical on each side. And then what I'm going to have the patient do is bend forward like you're going to touch their toes. So as he bends forward, You come back up. What's happening when my thumbs, I'm going to use my finger just so you can see. My finger's on the PSIS, right? When he bends forward, my fingers, or my thumb, should move forward, right? So that's what I'm looking for to some degree. Some of the artifact is his shirt moves, his pants moves, and that's what's moving, and that's what's moving your fingers. So you got to make sure you got good contact, so you're not getting the artifact of just clothing moving. Now, in this particular test, the side that is fixated will move more than the side that is normal. So in a normal situation, they'll both move because there's mobility when you do this, right? I mean, your pelvis is going forward and it's rotating. The side that's fixated, because it's fixated, it's going to pull it more. So you're still evaluating the same joint, but a positive is opposite. In the Stork test, a positive is no movement. In the seated and standing flexion test, a positive is movement. I know sometimes that gets confusing. So the other thing that I would recommend, when I do the standing test, I'm standing. Because by the time the patient is bent over, I'm able to have like vision right there and I can see what's going on. Because otherwise what happens, I'm doing this, bend forward, that's what I'm getting. It's just easier to be standing for that particular area. The thing to be aware of, and this is in your notes, if a patient has tight hamstrings, they attach to what part of the pelvis? What are your hammies attached to? Yeah. What is it? Ischial tuberosity.
Oh, yeah.
So, if he's got tight hamstrings and the patient bends forward, that tight hamstring may restrict that movement. So it's just kind of a question of being aware, by either palpation or muscle test or whatever, that could be an artifact. So the seated flexion test, I'm going to have the patient typically sit on a table.
So far away.
I should come over here. So, the same context. I find the PSIS, bend forward for me, looking for the same thing, come back up. Now, in this particular movement, they say that you're getting a little bit of a better sense of what's happening in the sacrum. And also in this particular movement, an artifact could be if you've got a constricted or tight quadratus lumborum, because it inserts along the pelvic crest, the iliac crest. And so if it's really tight, it can make more movement happen as well. So just, yeah, because it's tight, so it makes it move. Because it's shortened.
I got you, yeah.
Right? So those are the next two things I'm going to have you go over, is the Stork test and the seated and standing flexion test. I use the Stork test more than I use